Welcome back to What Matters This Week. I'm Lauren Maloney. Joining me now is Dr. Mary Cushman from the University of Vermont. Dr. Cushman, appreciate you being with us.
Thanks, it's great to be here.
Okay, let's talk about the University of Vermont is now home to a new center of biomedical research excellence, the Vermont Center for Cardiovascular and Brain Health. A lot of people will know you. I know you from the American Heart Association, so I understand the cardiovascular part. Explain to us where brain health comes in.
Yes, so increasingly in the last 10 or 20 years, we've recognized the close connections between cardiovascular health and brain health. And for example, we know that dementia and Alzheimer's disease have origins partly in the vascular system. For example, high blood pressure, hypertension is a risk factor for developing cognitive dysfunction and dementia. And so these interconnections of the two systems become increasingly important to helping solve questions about the causes and treatment of both disorders.
Dr. Cushman, this award is expected to bring nearly $12 million to UVM over 5 years. Why did you see a need in the Green Mountain State for this?
Well, we know that nationally, heart disease is the leading cause of death, and stroke is number 5. And we know that cognitive impairment and dementia are huge issues with our aging society, and Vermont is not immune to that. So Vermont is aging more rapidly than other states. We're 4th in the nation in the proportion of people over 65. So these diseases do affect people at all ages, but the risk is higher in older people. And the rate of Alzheimer's disease in Vermont, we're 5th in the nation in the rate of Alzheimer's disease. We're about 26th in the nation for heart disease. We're doing better for stroke. We're about 45th in the nation for stroke. Right now, about 13,000 Vermonters have Alzheimer's disease, and that affects them, of course, but also their families and caregivers. So we hope that with the center, we can perform research that will help to solve these pressing health questions and improve the health of Vermonters simply by having the center here and having it do research in Vermont, and for me to be able to talk with you about it so that people can learn more.
Is it just the research aspect? What benefit now will your patients, will you have with this money that you wouldn't ordinarily have?
Well, so the purpose of the center, the primary purpose is to conduct research. And the way that we're doing it is really novel. It's very different than other kinds of research grants. So really the purpose is for us to build a cadre of junior faculty who develop their careers by performing research with funding from the center. So I have a co-director, Dr. Mark Nelson, who's the chair of the pharmacology department. And we have 4 assistant professor faculty members from 3 different departments in 2 different colleges, the College of Medicine and the College of Nursing and Health Sciences, who are conducting research projects funded by the center. And the conduct of those projects will help them to achieve kind of their first independent step, if you will. It'll allow them to build the case to compete for NIH funding, especially. And once they achieve that NIH funding, their independent funding, they kind of graduate from the center. And so it's kind of like a training ground, as well as a scientific productivity ground. And the vision is that we're creating the next generation of scientists at UVM. You know, this center could be funded for 15 years, and probably I'm not going to be around running it for 15 years. You know, the people who are the junior faculty in it now will be ultimately taking over and building an even bigger center.
What patient ultimately do you have in mind for the research?
So 2 of our projects are in laboratories involving basic science research, utilizing animal models of brain disease. And one of our projects is using existing data from a large national population study that we've been involved with for many years here at the University of Vermont. The fourth study is an intervention study in patients who have recently experienced stroke. So this is being led by Dr. Denise Peters, who is in the Department of Rehabilitation and Movement Science. And she's studying how people recover their walking function after stroke. So she will have herself and her team up on the wards, meeting patients who are in the hospital for stroke, to ask them to enroll in her study, where she will do deep characterization of factors that relate to recovering walking function after stroke.
You had a big conference about this last week, you said. What was some of the reaction from fellow doctors, fellow scientists?
Yes, last week was our first annual research symposium. We'll be planning one every year during the course of the grant. It was a virtual symposium, of course. We're not ready yet to bring people into town and be all together in large groups. So we advertised this across the university and through our networks. And we had a keynote presentation from a scientist at McGill University who studies the brain blood vessels and their role in cognition. And we had a keynote scientist who talked about diversity, equity, and inclusion in the scientific workforce. And he is the chief of endocrinology at Wayne State University. So those were our external speakers. And then we had our 4 junior faculty funded investigators speak, and then a number of our junior faculty who are in our development program speak. And we had about 100 registrants, and we had people literally on the Zoom from as far away as Australia and Brazil. And this gentleman in Australia, it was remarkable because he essentially stayed up all night so that he could attend the conference. It was really fun to have him there. He stayed for the entire 2 days in the middle of the night for him. So I think I would say, of course, I'm biased because I was involved with the organization, but I would say it was a great success, and it helps to raise the visibility of the science that we're doing here at UVM as well.
Groundbreaking research happening in our own backyard. Dr. Cushman, thanks for joining us.
Great to be here.